Very good evening and welcome to Eclectica the Different News. Here I share about science awareness, about different careers, and bringing academia and industry people here to share their experiences. And through their fascinating life journeys, we learn a lot together. Well, I have something very, very interesting to offer to you today, which is about health informatics. I'm not sure whether you have heard it or not, but then we have a real person, and my gorgeous guest is just at the backstage. So, not wasting any bit of seconds, let me get my guest in, and whatever we will be learning from her through her journey, and you will see how people in different parts of the world are doing such great things and things that we really don't know always. It's not a traditional, conventional career path that you have to follow always. So I think that's beyond the textbook thing, and we have a real person today. So let me see if my guest is there at the backstage, and we will jam in understanding from her about health informatics. Hi, Nivetha. Thank you so much for being here and accepting my invitation for Eclectica. And so good to see you. And we'll have a lot of things to learn from you today.
Thank you. Thanks for your invitation, Dr. Gagi. It's my pleasure being here today.
Well, I think we are going to talk on a very interesting thing, a career path which you have chosen for yourself.
Mhm.
And I think your journey itself is very inspiring, and it's going to inspire a lot of young minds today who would be listening to us, or they will be listening to the recorded version as well. So, Nivita, we are talking about health informatics, and you have chosen this career path after your BDS or
BDS. Yes, that's right.
BDS in India. Yeah. So, can you tell me or tell us about a bit what exactly health informatics is all about?
Okay. Health informatics is concerned with data and technology. And in health informatics, we use data and technology to improve health outcomes and improve patient care, deliver quality patient care. So that's what health informatics is all about. And health informatics is a larger domain, it's a very broad domain. So it has a lot of different departments under it, like it has population health, community health, and then we have data analytics, and then we have process improvement, we have project management. There are lots to explore in health informatics. So in the recent times, I've seen that people focus only on the programming part or the IT part of it as far as health informatics is concerned. I've seen people mentioning only about data analytics, data science, and all that stuff, but it is not all about that alone. We do evidence based medicine. We develop clinical applications for improvement in healthcare, for patient education. All that comes under health informatics. So it is a very, very broad domain to talk about, and we have definitely a lot of things to discuss in health informatics. And so, yeah, that's about it.
Thank you for that crisp and precise and very simple explanation of such a broad based subject area.
Mhm.
Thank you for that answer. So, before ask you some specific questions, what is interesting me is that I need to know your journey altogether. I mean, what motivated you to pursue a career in health informatics after completing your BDS in India? Because I feel that this is not a very conventional path. So, can you just inspire us sharing your life journey or career journey till date? I mean,
Sure.
if that is okay with you, yeah.
Yeah. So, like everybody else, I was first interested in medicine. So, I somehow ended up in dentistry. And then for the first 2 years, I was looking into practice and I was trying for my master's. I wrote some of my PG examinations during that time. And soon after that, I got an opportunity from a medical litigation company in India. So I think that's where all of this started. And I gained exposure to US healthcare, US processes, how they do things, and how US law firms they sue cases, medical errors, medical negligence, medical malpractice, all of that stuff I got to know. And then we used to process cases that we get from the US, And then there were a set of doctors in my organization. Many of us were dentists, some of them were physiotherapists. So, and then we all would review the cases, we would look for errors, and then we would come up with chronological summaries or demand letters or whatever the client is demanding. So at that point of time, I understood a lot about US healthcare and its regulations, because US healthcare and regulations is far more different than what we see in India, because they are very much bothered, concerned about health data, security of health data, and all that, all those things. So that kind of intrigued my interest in the beginning. And then after that, I did very well in pharmacology during my college days. So somehow I ended up in clinical research too. I did a certification course in clinical research. And then I went into pharmacovigilance, which is the drug safety part of the clinical research. So I got placed in Icon, and then I worked for around 2 years in clinical research, and I learned a lot more about clinical trials, drugs, how the drug is developed, and all those things. So soon after moving from India, after coming to US, I was looking for something that was a program that could be miscellaneous, which could kind of use my experience and then boost my knowledge, broaden my skill set. So the program that I chose was based on the courses that the program offered. So it had everything that I wanted to learn. Like, for example, health administration. It had bits and pieces of everything. So it had health administration, it had statistics, biostatistics, and then a little bit of programming, and then everything. So it was just like a refresher, and at the same time, I could learn more and more about health informatics. And it helped me actually, you know discover which path I would like to take. So it had a broad set of topics on which I could decide on, and then pursue a career based on my interests. So that's what helped me land here in health informatics, and I think that's a good decision.
Definitely. I think that's very inspiring the way you have made yourself available, to different opportunities that has come into your way. I think this is very important because at least in Indian education system, we get more just converged rather than diversifying ourselves or,
Yeah.
just following a traditional path. So I think that's something which is very interesting about you, that you have not left any opportunity that has come, and today, today you are doing a fantastic thing. Really.
I would say it was a privilege, rather.
Yeah, yeah, definitely, definitely, because and not only privilege, because sometimes opportunities comes our way, but then we don't know whether to grab or not. So that decision making, I understand that you have a strong decision making skill, because probably that is most important in these kind of areas when you are getting into things which not everybody is doing, right?
Okay.
So
Yeah. It's
yeah,
not
so
very
great.
conventional. Yeah.
Yeah. So, well, coming to some specific questions which was running in my mind. Well, now you are into health informatics, and
Yeah.
dentistry is definitely not away from not away from our health. So
Yeah.
it's very much with us. So, how do you think that? Do you think like your dental background, your dental education has influenced your approach to health informatics some way?
Yeah, definitely. I would say yes, because as clinicians, we know the disease progression better. We know the physiology part of it, pathology part of it. We are well versed with knowing our patients, knowing the diseases well, knowing everything from the core part of it. We know everything well compared to other healthcare workers. So we are very well versed with clinical terminologies. We understand the process, we understand the treatment process, the prognosis, everything. So I think we are we would be able to provide valuable input when, say, for example, if they are developing a health application for a patient or for any consumer, they wouldn't definitely do it without consulting a doctor or a clinician, or without the
Right.
support of healthcare workers. So we are an integral part of developing any technology, healthcare technology, or healthcare applications for that matter. So I think that's what is an important aspect of me doing health informatics is, I that's why I think it's important for a clinician to be there in health informatics field, because not everybody else can do it, but only a few people who can, mediate between the IT department and the clinical department. Because once we do health informatics, we tend to gain knowledge in both the fields. One is the IT, that is the development part of the technology or application, and the other is the clinical team, where it is fully clinical. So they definitely need a mediator for this. So I think as people from clinical background or healthcare background, they'll be able to do well, because they have good knowledge of clinicals as well as the technology part once they finish health informatics. So I think we can play a good role in developing these applications. We can have a very good impact on changing patients' lives, improving outcomes. So it's a good decision when actually a person with a healthcare degree going into health informatics, it is a very good decision, because we are driving towards an IT oriented healthcare. And since the pandemic, I mean, we've been having a lot of telemedicine visits, and we've been doing everything virtual. So technology is growing day by day, and health informatics is an upcoming field. Having said that, health informatics is an upcoming field, and we would in future make a lot of things virtual. So I think more and more healthcare workers should come into this to support this, because it is mutually beneficial. It is beneficial for the patients as well as for the doctors, isn't it?
Right, absolutely right. Yeah, I think that because if we don't embrace the technology, we will be left out, to be very honest. So I
Yeah,
think that way, and as you rightly said, COVID has changed the scenario a lot globally. So I perhaps telemedicine was prevailing even pre-COVID, but
hmm,
teledentistry is something which came into the scenario. I mean, it was very fast growing in its pace due to COVID, because as far as my knowledge and understanding goes, that teledentistry was there. I'm not telling it wasn't, but it was not practiced in the way it is now being promoted,
yeah,
or
true. Hmm.
to be incorporated. I mean, the inspirations that are being shared worldwide to take all these things inside. So very interesting, Nivita, very interesting. So you know uh, with every new thing, or rather I would say, or when with every career path, there are challenges and opportunities which comes along. So my next question is to ask you that can you tell us about the key challenges and opportunities you see in the field of health informatics, and probably if you can highlight a bit in perspective of dental sector, that would be great.
Okay. You mean in India? Health informatics in
Yeah,
India
yeah, yeah,
challenge.
yeah,
Yeah.
yeah.
So, talking about the challenges, I think as a developing nation, we haven't yet fully digitalized everything. So we are going paper based still, but we are still transitioning. I'm not saying we haven't started anything yet, but I've seen a lot of hospitals and clinics do it. They are slowly transitioning from paper based to digital systems. So uh, but the challenge is the cost, because I don't think we have allocated enough funds for digitalizing healthcare, and healthcare system is a little more advanced in countries like United States or Australia. But in India, we are just still emerging. We are trying to do our best, and then we are trying to digitalize. So this is one challenge that I could see right now. But down the line, in 5 to 10 years, I think this would also be gone, because by then, like every other nation, we would also grow, obviously. So this is one challenge that I could see. And then the other challenge is that resistance from physicians or clinicians, because not all clinicians or doctors, they would be comfortable using technology in India, I'm saying. Because some senior physicians, if you might see, they're not very comfortable with technology. They always tend to go paper based. They are very comfortable with
Right.
paper based treatment and everything. So that would be one of the challenges, but we can overcome those challenges with enough training, with education and awareness. So that's one challenge. And the other challenge, as I mentioned, was cost, and the other big challenge is time. We would take a lot of time to get there, where US and Australia are here today. We would take probably a long time to get here. And as far as opportunities is concerned, as you said, COVID-19 has paved the path really. So from then on, we've been having televisits, so teledentistry, telemedicine visits. So that is a very great opportunity as far as dentistry is concerned also. So we are able to see digital images, digital X-rays, and then we are able to
Right.
send it through email. So we can virtually set up a call with a dentist, integrate the process with various dentist specialists, doctors, and then we can come up with a treatment plan without the patient being physically present in the office. So that is one big advantage, I think. That is the opportunity that I see, virtual visits. And then especially educating patients about dental health, because many people tend to have an idea like dental health is something separate from general health. They don't see it as a unit, right? As dentists we know, because general health is something different from oral health according to few patients, not everyone, because some people are very well aware of oral health. They are very conscious. But I think health informatics is useful in educating patients, in improving their awareness towards oral
Hmm.
health, I would say.
Right, right, very rightly said. And like as you said, the type of applications that are coming up now, so many companies are coming up with particularly dental diagnosis. I'm talking about, like, you can scan your mouth and get a report. So those things, even I think 5 years back, it was not the way as it is in at the end of 22 or beginning of 23. And
Definitely, yeah.
that is
We are
very
moving
inspiring.
forward somehow.
Yes,
So
yes, exactly, exactly. So Nivetha, I think, it's a fascinating area that we are talking about today. So can you share some examples of how health informatics has been used to improve patient care, in a way that, or management in that way? Can you give us some general idea on this?
So, as I said, patient healthcare improvement. When I say patient healthcare improvement, it is all about how the patient feels about the care they receive, and how the hospital really performs. So it goes hand in hand. The patient care and the quality of service that the clinics or the hospitals provide, both of these factors go hand in hand, because uh, if the quality of care is enhanced, automatically the patient satisfaction is higher. So in health informatics, what we do is we develop applications. We develop methodologies, to be specific, methodologies to improve patient satisfaction, to improve the quality of care that they get, to improve the security and safety of their health data, and all those things. So what we can do to improve patient satisfaction is we can take patient feedback surveys. We can talk to the patients and get their reviews, and we can provide them with a training material, or awareness, health education awareness material or something, and then ask for their feedback, or specific feedback on any physician or specialist that they've met with. And then we can use this data and track how the hospital or the physician is actually performing, what kind of care do they give to their patients. So all these data go into process improvement. So we track each and everything that happens in the entire end-to-end healthcare process, right from the time when patient comes into the office, dental office, or any medical office for that matter, from that time onwards until the patient leaves the office, and after they complete their treatment, what is their response, uh, you know what kind of reviews do they provide to their healthcare providers. So all this is collected to see where there is a gap in improving uh, patient care. So if there is a gap in for example, there might be processes in a hospital where there are no value added activities, like they might be doing a documentation for the purpose of just doing it, but it will still be a waste of time. So the patient might be waiting in the lobby, and they still they might have a serious they might have dental pain or any serious condition, and that heavily impacts their life, quality of life. So uh, to prevent to prevent those things from happening, what we can do is we can take a look at the process in the clinics or the hospitals, and then we can talk to the physicians and the team of nurses or whoever is working over there. And then we can usually what we do is we track down each process, and then we see what is necessary and what is not necessary. If there has to be a checklist for certain processes to be done, for example, sanitation is a very important process, and then autoclaving your instruments, for example, that is a very important process, we cannot skip that. So all that has to be included. So we make sure that the quality is there, we don't compromise on the quality that is provided to the patient, but still we try to cut down the shortages, we try to cut down the time, wasted time, to improve the performance of the hospital or the clinic. So this is what we do in any hospital or a dental clinic management. We try to do and improve the practice this way. So once we do this, automatically the patient, the quality of care that the patient receives is improved, and we are going to obviously get better feedbacks. So not only this, but we would also go into the clinical side of it, because we want to know how our doctors perform. So we will track their, you know, performance data. We find out from patients how they talk, how they behave. All that matters, because it is not only anymore, it is not anymore like only the clinical part, and you cannot just ignore the other parts in today's world.
Exactly.
So everything matters, how the physician communicates, how they provide a treatment plan, how will they follow up with the patient, how will they ensure that the patient is compliant, all that comes into it. So we would do a feedback survey or collect data based on this, and then we try and improve the patient care.
Fantastic, fantastic. Thank you, Nivetha, for that answer. And well, coming to the next question, when it comes to clinical practice, whether it is dental or health medicine practice, anyway. So the question that I want to ask you is that how can clinicians leverage health informatics to enhance their clinical decision making and treatment planning processes? How is this area, I mean, can you highlight this aspect a bit?
So so I would like go into a gist of what is clinical decision support system first, because
Right.
clinical decision support system is something that we do with the data, with the healthcare data. See, for example, if in case we have the patient health data in a dental record system or a electronic health record system, then it becomes very easy to do a clinical decision support system, because everything is automated, everything is software based. So we have a
Right.
programming or a code running at the back end, and then it gives
Hmm.
you everything. So without this, if we look at the clinical decision support system, it is quite difficult, because you cannot keep track of each and everything that a patient, each and every condition that a patient has. They might have
Correct.
allergies, they might have other habits like suppose if they have habits like alcohol, you should be cautious with prescribing medications like warfarin or any, you know, Tylenol or stuff like that. So we should be cautious about prescribing drugs based on their individual health conditions, habits, or whatever medications that they're allergic to. So all these play an important part in treatment plan. So to if at all, if we leave out all this, then we would tend to make medical errors that can even be life threatening. So it is very important that we consider that. So this is where the clinical decision support system plays a role, because we collect all of the patient's data. It can be any visit. It can be a visit which was 3 years ago, a visit which was 4 or 5 months ago, and then we collect all this data, and all this data is integrated in an electronic dental system or an electronic healthcare record system. And with this data, what we do is the system automates everything. So it checks for certain rules and criterias to see if the patient has any drug contraindication. If they have been if they've been taken if they've taken warfarin, for example, they might have certain contraindications with certain medications. If they have high blood pressure, they might have certain contraindications. So all that, using the application, using the system, using the database, all that can be automated, and the physician or the clinician, whoever treats the patient, they get an alert notification. So once they handle the patient, once they take a look into their problem, once they get into their health data, they take a look at all the data that is available, and the system automatically triggers if there is any health issue that the doctor has to know, or if they are prescribing some medication that is contraindicated for that particular patient. So everything gets, uh, depending upon the programming, depending upon the analytics, depending upon the data that is there in the system for that individual patient, it sends out an alert to the physician. So once the physician sees the alert or the notification, they are aware that they are not supposed to prescribe a medication, or they are aware that they're not supposed to do a certain treatment process at that point of time, because the patient might be having a condition that might aggravate it, or that might be injurious to, I mean, life threatening for them. So that's the role of clinical decision support system, and it is very important to have it, because we can prevent medical errors. And most of the cases in US, there are lots of medical errors that happen in the US because of wrong medication errors, or uh, anything for that matter. So it is always best to have a clinical decision support system in practice. And then apart from this, I would also say evidence based medicine, which is trending today in healthcare. I think there are many practitioners who know about evidence based healthcare, because it is almost like informed decision, because we consider the patient's choices in the treatment plan. And then we research a lot, we do literature reviews before taking a call on the diagnosis and treatment plan. And then, so that we can tailor the needs of the patient, we can tailor the diagnosis and treatment plan based on what we see, what the patient needs actually at that point of time. So it is actually a triad. It includes literature review, it includes the skills of the physician, and then it includes the patient's choices, whatever decision they are comfortable with. Some people might not like very invasive procedures, so we might have to make adjustments according to that. So that's where evidence based medicine helps a lot. So these are some examples of clinical decision support system, and I think it is very much essential in today's practice, as things are
Absolutely.
getting more and more complex day by day,
Correct.
because
Correct. And thank you for that extensive, overview, or telling us about the entire paraphernalia, because I think this is something which we need. Really, it is very interesting, and it will ultimately help the clinician as well as the patients at the end of the day. And as clinicians, for any clinician for that matter, ultimately is the patient's satisfaction, or how we can change the lives of the patient. So more it is error free, it is better, definitely. So I think it is fantastic, Nivetha, to know all these things from you. It's very interesting, actually. So well, now that you say that there is so much is happening and we see a lot, so can you tell us some of the current trends and emerging technologies in health informatics, which according to you would be, is very promising, or it is very exciting for that way?
okay. As far as medicine is concerned, I mean, there are lots of technologies emerging, like uh, in fact, even in dentistry, we have this cone beam computed tomography,
Right.
which provides 3D images of the X-ray. And the best part of it is, we eliminate the disadvantage of conventional X-ray errors. So we get a detailed image, a 3D image, which helps us eliminate a lot of errors. And then we clearly take a look at the picture, and then we are able to see what's going on the inside. we, uh, so that we can tailor our treatment plans based on that. We don't have to do a trial and error, we don't have to see if it works, or if it doesn't work, we'll go to the next treatment plan. We don't have to, there won't be any dilemma. We straight away know what the problem is based on the image, because it is going to be a very detailed scan, a detailed image, 3D image. So, and another example would be intraoral scanners, like the one that you mentioned. So there are many people that use it for Invisalign. So they're able to scan, make impressions, and the impressions are too fine. They are not like the ones that are handmade. So I think that is a nice thing. I think that's a promising technology that we have in the dental field. um, and then for the medical field, I think AI is an emerging one right now for medicine, because machine learning and data analytics is a crucial part of health informatics. So based on data, everything is studied. The machine learns everything. It tells you what you need to know and what you can predict in the future. They do a lot of predictive modeling, and then they find out what factors contribute to cardiac arrest, or what factors actually contribute to death due to cardiac arrest. So there's a difference, because simply having a cardiac arrest or having a death due to cardiac arrest is something different. So a machine learning model or a predictive model will always help you understand in detail what is going on. So are there any patterns involved in this disease progression? Are there any because we have a large set of data from various patients, various ethnic backgrounds, various racial backgrounds all over the world. So when the data gets larger and larger, maybe we can have better results, we can have reliable results. So that's an emerging trend in general medicine, be it dentistry or general medicine. I think machine learning is one of the emerging trends that I could see, and it's far more interesting. And then we have data analytics to improve population health or community health. We can reach out to people, educate them. We can do predictive modeling for those set of people, and then we can let them know if if they're going to have uh, any infectious breakout spread out, any pandemic or endemic for that matter. So we can educate them, we can prepare them for anything of that sort before the damage happens actually. So it is helpful in planning out things, executing things well, and then preparing patients, educating patients, building more and more awareness, and then improving overall health in patients, not only for general patients, but even for the rural areas. They don't have much access to healthcare providers or dental providers.
Right.
Everybody has a mobile phone nowadays, so we can reach out to them any somehow they we can reach out to them through an application, or through an email or whatever. So we can always help them out. So that's a boon in today's healthcare technology, I would say.
Correct, correct. So it is very interesting talking to you, and I think we can talk hours together on this topic.
Yeah.
Yeah. So just that we are concluding in the concluding part. So Nivetha, uh, can you just tell me that if somebody wants to follow a career path as you did, like getting into health informatics, what would be the basic eligibility criteria to get into any course which is offered by certain universities to actually get into this field after doing dentistry in India,
Okay.
BDS particularly? Yeah.
So, what I would suggest is, instead of transitioning directly from clinicals to health informatics, it would be a little challenging, because um, as health informaticians, when we start, we need some sort of, we need some basic computer skills, the basics of, Excel or PowerPoint, or whatever is there. So we need to know how applications work. We need to know how healthcare operations work for us to understand healthcare informatics. So if you kind of directly transition from a clinical background into health informatics, it is going to be overwhelming in the beginning. So what I would suggest is, you can go for courses. There are lots of online courses available. Whatever interests you, maybe it can be healthcare operations, or for example, like what I did, it can be clinical research. Go into
Correct.
some courses of that sort, or even you can try educating yourself. There are lots of videos on YouTube. There is LinkedIn learning these days. There are lots of learning platforms. So we should basically help ourselves to upskill, and then we should go into it. So only when you upskill, and then when you go into it, it becomes easy for you to succeed in that particular area. So directly transitioning from clinicals to health informatics, I wouldn't really recommend. But once you educate yourself, you do a small course or something like that, or you network a lot, get to
Right.
know a lot of stuff from people who are already ahead of you, or who have already done similar courses that interest you, actually you can find out from them. So there are lots of people readily available to help these days. It's not like the olden days, so we can easily reach out to anyone we would like to talk to, and then they should be able to provide the help that they can. And one more thing that I would like to say is the course that you choose. So uh, before choosing the courses, you should be able to see what kind of skill set that you have. I mean, apart from the clinical skills, I'm talking about the technical skills.
Right.
One has to know what kind of technical skills they have. It can and the soft skills also. So if you have good attention to detail, it can be a valuable addition. So and then interpersonal skills or communication for project management and all that stuff, we need good communication skills, good interpersonal skills. So if a person is interested in the project management part of informatics, they can go into it really, if they have those skills. And if they're very good at computer programming, and they're very good at technical skills, they can choose data analytics, MS Excel if they are interested in. They can do Python programming, there is SQL. They can go into building software applications. There are few developers actually, some people whom I know, they are from a clinical background, but because of their interest solely, they have gone into IT as developers. Some people do that. But if you don't want to do that, it's up to you. It's up to you to decide how your skill set aligns with the course you choose, because each university is going to have different set of subjects, that is the courses. Some might align with your skill set, some might not align with your skill set. So there are some courses which have a digital informatics track, which might be too much of software to learn. The program that I did had lots of courses. I mean, a variety of courses. It was a miscellaneous program for me, so I enjoyed doing my program because it was around process improvement, and then Lean Six Sigma, and then a variety of things like this. I learned a little bit of SQL too. So
Okay.
if you want to explore everything and then choose a career towards what interests you, you can do that too. But be a little cautious about choosing your program, because if you don't want programming and if you take a course that includes core programming, then it would be a little difficult for you. So be careful about choosing your program. That is another thing that I would insist to be successful in this role.
Thank you, Navitha. And just that I asked this to all of my guests at the end, like, what advice would you give to dental students or practitioners in India who are interested in exploring a career like you? What would be your advice? I think you have already shared a lot of advice, but then what would be the last message that you would like to share on this platform?
um Advice in the sense, what do you mean? You mean a general perspective advice, or a technical perspective advice? So,
Anything that you feel would be really valuable for a person, for the student who has just finished and they are confused to do uh, the next thing, probably
okay.
not the following the traditional path, or yeah.
Okay, not the, I mean, a path away from the traditional clinical practice. That's what you mean.
Right. Right.
Okay, that's what I was saying. There are a lot of sectors like, I know you've been talking about medical writing.
Yes,
So
I do. Yeah.
genomics, yeah, you've done
Yeah.
a fabulous job. I've been following your work closely,
Thank
so
you.
it's fantastic. So there are lots of things like that to explore for each and every person. So they can get into medical writing if they want to. They can do freelancing jobs. The thing is, they have to get acquainted to non-traditional clinical stuff apart from clinical practice. If they're going to only stick on to clinical practice, in India especially, there's a stereotype like, if you're a doctor, you're not supposed to do this, that you're
Correct.
supposed to only attend patients. No, that's not true. Because all
Correct.
over the world there are clinicians who go into they get their literature reviews done. They look at a lot of journals, and then they decide treatment plans based on that. They do a lot of research. Basically, apart from the clinical work, they do a lot of research. They have conferences and all that stuff. So for a new dental graduate, I would say give some time to yourself to self analyze what you really want to do. Because if you're interested in clinicals, if you really have a passion for it, you have 100% passion for it, then go for it. If you want to try something different, try something new, then you have to do a lot of research on it. You have to search for a lot of articles online. There are a lot of journals available, lots of videos, guidance videos available. A lot of people are ready out there to help. So you can internationally reach out to anybody. So it's not
Correct.
like the olden days. You can reach out to anybody, ask for help. And then there are some courses on Udemy also, Udemy, Coursera. They can go into it and then just take a general overview of what all is there, and whatever is interesting, sounds interesting to them. And then find out more about themselves first. That's what I would suggest as an additional tip. You should be able to analyze yourself and find out more about what you like, and then go for it. So then it will be easy for you to track down and get into a career path that you would excel in. So that's what I suggest.
Thank you, Niveta, for your time and for this wonderful information sharing, knowledge sharing. And it was fantastic talking to you today here and understanding from you all about health informatics as a career. And I wish you all the best for all your future endeavors. And probably we will meet again in future and with
Hopefully.
such kind of interesting conversation. Thank you so much.
Thank you, Dr. Gagin. Nice meeting you. Nice talking to you.